Welcome to Dr Joe Unplugged. This podcast contains general information and is not in any way medical advice. Late President Dwight D. Eisenhower coined the term the military-industrial complex when he left office to describe his concerns about the influence of the military just doing, I suppose, mission and bracket creep and expanding itself into areas where maybe it shouldn't. The term has been paraphrased in a number of different areas, and the medical industrial concept is one that is starting to gain a little bit of traction. And essentially it's bracket and mission creep of medicine looking to expand where one can diagnose and treat conditions. And we've spoken in a previous podcast about thresholds and how every time they are lowered, whether it's for diabetes or cholesterol or blood pressure, you create a whole new group of people who until yesterday had nothing wrong with them and are now classed as having some type of condition that needs treatment. And again, there's times when that's useful, but there just seems to be a very strong trend in that direction. We now move further to the concept of pre-diseases and the concept of pre-hypertension. So before you have high blood pressure, instead of just calling it normal blood pressure, we're going to call it pre-hypertension. And we have pre-diabetes, which again is you don't have diabetes, but you might get it one day. Now, in fairness, there is a grey zone with diabetes where your sugars may not be in the advised or recommended or below the cutoff, perhaps the best way to put it, but not necessarily at levels which are diabetes. So there is that grey zone. And there is now, which is a good thing, some argument on whether pre-diabetes is overdiagnosed. In a published editorial, a public health expert says she believes that physicians should be more cautious when diagnosing someone with pre-diabetes because of the potential harm it can cause. In a second editorial, another expert states that pre-diabetes can lead to serious health issues and should be diagnosed as early as necessary. Other experts say treatment for pre-diabetes should be unique to the patient, with lifestyle factors being the first-line treatment and medications considered when lifestyle changes do not work. Always fun when experts disagree, and it is one of the joys, in inverted commas, maybe that's not a great term, in medicine. I don't think it's actually just in medicine that there's so much expertise that you can pretty much choose the expertise and experts that suits your point of view. But before, even considering whether it's diagnosed too often or not often enough, is it actually a diagnosis? Is it a medical condition? And that, I think, is the discussion that's not being had. Experts disagree over how and when to screen for this potential precursor. Well, essentially, it really means just checking people's blood sugars. Now, if there's a family history in your family of diabetes, and we're talking about type 2 here, so maybe you should just divert for a moment and say type 1 diabetes, where the body does not produce enough insulin. Those people need insulin injections for life, is generally comes on in childhood, and people will be diagnosed typically before the age of 18. Again, not always, but more typically. Type 2 comes on later in life, is much more related to lifestyle. There are some genetic tendencies, but much less so than in type 1. So the question really becomes, do we need to be talking about pre-diabetes, or should we be framing this as, if we're sensible with our diet, if we're doing some regular exercise, if we're not carrying too much weight, that it makes it less likely that we will get a variety of conditions, and that includes diabetes, includes high blood pressure, includes stroke, heart disease, even some cancers. So rather than us having, pre-cancer or pre-diabetes or pre-something else, maybe there's absolutely nothing wrong with us until there is. Now, can we be on the road to it? Yes, we can. Can we be on the road to diabetes if our sugars are creeping up over the years? Yes, that is possible. Is that a medical condition? Well, this is where the arguments rage, but it might be much more useful. And again, the first professor who says that it can be harmful. Look, putting labels on people, I'm not sure that's a really good idea for a variety of reasons, including people can then start to think, well, if I've got pre-diabetes, I'm just going to get diabetes and there's nothing I can do about it, which is not the right message. And also, for insurance purposes, once there is an established diagnosis, then that can affect insurability. Now, if it's there, it shouldn't be hidden. But this is the whole argument: is it a condition, or is there nothing wrong with you? You might be heading in a particular direction, but you're not there until you're there. If you're travelling to a town, until you reach that town, you might be on the road to it, but it can't be said that you're there. Because you might turn around and go in a different direction. So it's not a given. And I think that's what's possibly missing in this, that there is an inherent assumption in this debate that it's a one-way street. It's not a one-way street. In fact, people who have type 2 diabetes can go, in some instances, into remission, and they can improve their control or improve their control considerably with the dietary change. Now, a lot of those people may also need medications. Some of them eventually come off medication if they do well enough. Not everybody does, and you can only do what you can do. But the idea that we have to classify people who ostensibly have got no problems but might be, in inverted commas, at risk or going down a pathway as having something, when in actual fact the discussion should be much more, well, how can you stay healthy? What can we do to maintain your health versus trying to avoid disease? And whilst those two do have overlap, they are not synonymous. Trying to avoid a whole series of different conditions can be like trying to run an obstacle course. Whereas focusing on being healthy in the global sense, I want to be as healthy as I can be in terms of my mind, body and spirit, then that makes it the least likely that we will develop any sort of condition. It's not a force field. There are no guarantees in life. We can get run over by trucks as well. It happens. People can get struck down with cancer who've done all the right things. It doesn't happen that often, but it does happen. So there are no force fields or guarantees. But if we focus on being healthy rather than focus on trying to avoid a variety of different conditions, the end result is that, number one, obviously we will be healthier, and number two, because we are healthier, we are less likely to get all of these conditions that we otherwise might be busily trying to avoid. In my book that I wrote some years ago, I coined a term. Some people didn't like it. I did. Was the best way not to be sick is to be healthy, which sounds a bit circular, but essentially it's saying if you focus on your health, it's less likely, again, really want to emphasise, not impossible, but less likely that you are going to get sick. Thanks for listening to Dr. Joe Unplugged. If you enjoyed this podcast, please subscribe, like and share. You can also follow it on all the socials. There'll be new content uploaded each week.